All right, so rabies is an infection of the central nervous system caused by the rabies virus. It is most commonly spread from the bite of an infected animal, usually thought of as dogs, but also bats and a few others, as we'll discuss later. Uh, Prevention is essentially boils down to control of the virus in animals. You want to make sure that animals are vaccinated, or domestic animals are vaccinated wherever possible. Wildlife, vaccinated, keep away from infected animals, um, things like that. Once a person is bitten, the virus will enter the nerves, spread into the central nervous system, where that helps the virus invade the immune system. And left untreated, you end up with a fatal encephalitis or brain infection, brain swelling. The time it takes to enter the central nervous system is the opportunity for preventative measures, namely vaccination and immunoglobulins. As mentioned, the condition is typically transmitted by animal bites, saliva, aerosolized secretions, and things like that. People tend to associate the condition with dogs, and around the world, unvaccinated dogs are the most common source. But in developed nations, less than about 5% of cases will come from dogs. Bats are more common in the US, for example. Wild animals such as coyotes, wolves, jackals, foxes, a bit more rarely skunks and raccoons. That one's more limited to certain parts of the US. Most rodents won't survive long enough to transmit the virus, they'll just die too quickly. The main exception to that is the groundhog. Transmission from one human to another is pretty rare. It can theoretically occur with organ transplant from an infected host. Much more rarely would be things like bites, open scratches from an infected person. This is extraordinarily rare and basically doesn't happen that much. The disease progresses through several stages, and the signs and symptoms you will see will vary depending on the stage of infection. These stages are incubation, prodromal period, the acute neurologic period, paralysis, coma, and eventually death. The incubation period can last from 20 to 90 days, and during this time the patient is asymptomatic. The prodrome can last 2 to 10 days. The most specific symptoms seen during this stage are paresthesia or numbness, pain, itching at the site of the bite. Other symptoms can be fairly non-specific: malaise, anorexia, headaches, fever, chills, sore throat, vomiting, anxiety, depression, and so on. As it moves into the central nervous system, here we will see things like headache, being sensitive to light, altered mental status, things like that. The acute neurologic period can last 2 to 7 days, and this stage is most notable for what's called furious rabies. These patients will have short episodes of being very agitated, hyperactive, hallucinating, delirious, not speaking, eventually maybe biting people between, showing signs of confusion, things like that. These episodes can be triggered by specific stimuli, or they can happen seemingly randomly. You may also see things like seizures, muscle twitching, priapism, and the like. About half of patients will show what is called hydrophobia, or where they have a severe spasm of the throat and a feeling that they can't breathe when they try to drink water. We may also see certain defects of the autonomic nervous system, things like heart rate issues, fever, blood pressure issues, sweating, drooling, things like that. Patients could die during this stage or progress on to paralysis and coma, and then the paralysis can be similar to that of polio. It typically starts in the limb that was bitten before progressing to the rest of the body. Coma typically occurs within 10 days of symptom onset, and the duration varies. Death is pretty quickly unless there is intensive care support almost immediately provided. Intensive care can let you live up to 3 to 4 months. And the coma itself, of course, eventually progresses to death one way or the other without vaccination. Vaccination must be given in that incubation period before symptoms set in to be of use. The diagnosis, as always, begins with the history and physical. Yes, for the history of the bite. Yes, for the signs and symptoms we just discussed. If possible, we try to observe and test the animal responsible for the bite. A lumbar puncture or spinal tap removes fluid from the spinal column and lets you test it for various factors. The cerebrospinal fluid in an infected patient will usually show things like elevated levels of protein and white blood cells. You can also do a test called polymerase chain reaction, where we directly look for the nucleic acids of rabies. That can be done on the spinal fluid. Various additional laboratory tests can be ordered. Antibodies aren't necessarily always helpful because the patient might die before the antibodies show up in the blood. I can do blood gases looking for changes in the acid-base status of the patient for the white blood cells. You can do urine tests. You can do imaging tests like X-rays, MRIs, CTs. The imaging tests aren't necessarily the best because while they can sometimes show changes in the brain, sometimes they can be normal even in an infected patient. So a normal MRI doesn't necessarily rule out rabies. A skin biopsy is one thing that's particularly diagnostic because it can directly find the rabies antigen in the sensory nerves. Several groups of people are at higher risk, most notably those that have direct contact with infected animals. Contact with an infected animal is more likely if you're in an area where rabies is poorly controlled. Those working in veterinary medicine are also at high risk, as are laboratory workers who research rabies. Finally, as with nearly all infections, the immunocompromised are also at higher risk. For prevention, avoid the virus as best. Avoid the endemic areas. Don't annoy wild animals. Don't hang out in the bat cave. Vaccinate your pets that can potentially get the condition. People at the higher risk groups mentioned last time should get vaccinated as well. And those who get bit by an infected animal absolutely must have the vaccine. We should educate people about the necessity of the vaccine, about how to avoid wild animals, to take care of their pets properly, to get care for animal bites and things of that nature. And infected people and animals should be isolated. A little bit more indirect, changes in the epidemiology of the disease are expected with climate change. As the world warms, animals can move into new habitats, and this could theoretically spread rabies. So efforts to fight climate change could also more indirectly aid rabies prevention. So history and physical, as I said, is the first step in case management. It should include bites, contact with animals, any hobbies like hunting or caves that'll bring people in contact, travel history, any clinical signs, examination of the bite wound, how did they get bit, what type of animal was it, and so on. If possible, capture, observe, and test the animal. Depending on how common rabies is in your area, you may be able to delay treatment until after the animal has been examined, or if it's really popular in your, or really common in your area, you may need to begin treatment immediately. If you're in an endemic area, prophylaxis should always begin right away. Local public health authorities can be very helpful for guidance in this area. Any wounds should be cleaned, deburied it. You should search for foreign bodies, including the remains of animal teeth and things like that. Children especially are prone to be bitten in things like the face, the hands, the upper body. They may require inpatient management to care for the wounds. We're going to carry out the diagnostic process we discussed in the previous slide. Prophylactic treatment is with anti-rabies immunoglobulin and vaccination. Immunoglobulin should be provided to anybody not previously vaccinated. Vaccine takes about a week or two to kick in, so the immunoglobulins help you in the meantime. Vaccination is essential to anyone who's gone more than 5 years without getting a previous vaccine. The number of patients who have survived without vaccination is extremely few, I believe only on the order of 1 or 2 in all recorded history. Patient needs to be transferred to a tertiary care center that can put them into intensive care if necessary. Once the patient is symptomatic, the vaccine is no longer helpful, and while intensive care can be attempted, it's almost always fatal. Mentioned 1 or 2 patients have survived with antiviral therapy, things like ribavirin, amantadine, interferon, and the like, along with an induced coma. But as mentioned, this usually doesn't work. Only 1 or 2 patients have survived. Other treatment is supportive, and you keep them alive as long as you can, but like I said, once it sets in, they're pretty much done. Here's some references, and thank you.